Medical and recreational marijuana may be legal here in Massachusetts, but we're one of only 19 states where it is legal for recreational use and one of only 36 states in the country where it's legal for medical reasons. That could change, though, because Friday the U.S. House passed the MORE Act, which is a bill aimed at decriminalizing marijuana federally. So joining us now to talk about all of this is Dr. Ben Caplan, who is a family medicine doctor and the founder of the Seed Clinic. Dr. Caplan, thanks for coming in and joining us live here this morning.
Thanks for having me.
First of all, let's talk about what the MORE Act would do. I understand it would, federal legalize, change this federal ban, legalize it nationally, but still some of this would be left up to states to talk about that.
Yeah, the MORE Act is a tremendous move in the right direction. I don't think it has 60 votes to pass in the Senate, but it does bring us a lot of really important opportunities. One, socially, it helps end stigma for the thousands of people on the sidelines still unsure about what to do about cannabis. It also helps economically. It opens up banking for small businesses worldwide in these areas. And medically, it opens up research. We need more research. We need education. A substance that has no medical value, according to the government, is not going to be taught in medical schools.
Would it impact us here in Massachusetts where it's already legal?
It does have impact generally because of the way it's seen. There are many people who need a good housekeeping seal of approval by the government to tell them what foods they should eat, what medicines they should take, and this helps toward that direction.
Would it also help with some of the red tape? Have you experienced some red tape trying to get prescriptions for some of your patients?
I've had some insurance companies, private insurance companies will cover cannabis by reimbursement. Some of them will cover over interest, but there's not too much red tape already in Massachusetts. We're very fortunate here.
Okay, and let's talk about the range of conditions that you are treating patients with cannabis for. You've treated tens of thousands of patients for everything, I understand, from sleep issues to female reproductive issues to autism. I've been pretty public about this as a parent of a child with autism myself. One question that I had is, what are you seeing? What kinds of benefits are you seeing for these kids with autism? And also, what do the studies say about whether this is safe for a young child's brain that's still developing?
Yeah, I have the great privilege of treating both young and old across the spectrum of illnesses, some chronic illnesses, some end-of-life care, but also some more common things like depression, anxiety, terrible pain. The methods of consumption range. We're not giving people joints to smoke. We're really personalizing care so that they get the benefit that they're hoping for.
So what kind of benefits have you seen? Let's talk specifically about kids with autism. What kind of improvements have you seen?
So I've seen children who are nonverbal be able to start muttering words and start putting pieces together. This ends a little bit of anxiety for the children. It also helps decrease inflammation for children. The effects are really tremendous.
I'm sure behavioral probably is a big thing too. Kids with autism often have behavioral problems.
Sure, a lot of these kids are having outbursts and being violent, and to have something that can help calm them down, help them feel more comfortable in their own, is really miraculous.
And what do the studies say about how safe this is? Obviously this is kind of relatively new treatment, so I would imagine there aren't many studies talking about long-term effects.
Yeah, I'll tell you, on the front lines of care, I've seen tens of thousands of children. All of the myths that we all grew up with, that this was going to hurt people or make them become drug dealers, just haven't materialized. It's helping people right, left, and center.
And you mentioned reproductive issues too as being another disorder that you're using cannabis for. How does that help women with reproductive issues?
Think of all the women who are suffering monthly with terrible cramping. There's endometriosis where these women can't function, they can't go to work, they're feeling miserable, and it's giving them a new freedom.
Okay. All right, Dr. Caplan, where can we go to learn more about what services that you have to offer here in Massachusetts?
I'm all over social media, near and far. Please reach out. I love helping anybody that's looking for some assistance.
And we know you'll be watching the MORE Act, and we'll be keeping our viewers posted on what happens with that as well in Congress. All right, Dr. Caplan, thanks for joining us live this morning. It was nice to have you coming into our studios. Let's toss things over to Catherine right now for a look at the